Good day, sir. I'm Jimmy Simillanes and I'm here to present a video discussion of First Aid Basic. First Aid Basic. First aid is an immediate and temporary care given to a person who has been injured or suddenly taken ill. Like what we know about first aid. First aid is a process of taking care of a person injured. Like example, your brother or your sister have cut his/her finger. You are already helped them by using kits like alcohol and cotton or bandage. Objectives of first aid: to elaborate suffering, to prevent added further injury or danger, to prolong life. Characteristic of a good first aider. First, gentle does not cause pain and panic. Second, observant notice all signs. Third, resourceful, makes the best use of things at hand. Fourth, tactful, does not frighten the victim. Fifth, sympathetic, comfort and resource the victim. Common injuries encountered by officiating official and athletes. Sprain is caused by turn fever in a ligament, swelling, and bracing are some signs and symptoms. Other serious injuries that requires immediate care or first aid include heat exhaustion is a response to heat characterized by fatigue, weakness, and collapse due to indicate intakes of water to compensate for loss of fluids during sweating. Sprains versus strains. Sprain is a stretch or tear of a ligament that hand of connective tissue that join the end of one bone with another. Strain is a twist, pull or tear of a muscles or tendon, a cord of tissue connecting muscles to the bone. Knee injuries is the most commonly injured joint and can result from a blow or twist to the knee from improper landing after a jump or from running too hard, too much or without proper warm-up. Fracture. Acute fracture is a break in the bone that can occur from either a quick one-time injury to the bone. Stress fracture, from repeated stress to the bone over time. RICE method, in short, RICE, is a mnemonic acronym for 4 elements of treatment for soft tissue injuries: wrist, ice, compression, and elevation. RICE is considered a first aid treatment rather than a core for soft tissue injuries. Dislocation. When the two bones that come together to form a joint become separated, the joint is described as being dislocated. Wrist. The injured part, especially for the first 24 to 48 hours after the injury, this is the most critical time of treatment. Avoid any activity that causes pain or makes it worse. Use scratches if the leg, foot, or ankle is injured. Support an injured wrist, arm, or shoulder with a sling. Tape an injured toe or finger to its healthy neighbor. Ice is an excellent anti-inflammatory and reduces swelling and pain. Apply an ice pack or cold compress for 10 to 15 minutes as soon as possible. After an injury, repeat each hour for the first 3 or 4 hours, then 4 times a day for the next 2 to 3 days. Protect your skin with thin cloth. If ice pack are not available, a packet of frozen vegetables in a cloth will do. Elevation drains fluid from injured tissues. Elevate the injured area whenever you are sitting or lying down. Try to keep the injured area at or above the level of the heart. Compression also reduce swelling. Use elastic bandage for at least 2 days. Check the bandage is snug but not too tight. Take the bandage off at night. Rules and responsibilities of a first aid provider. First, act as a bridge that fills the gap between the victim and the physician. 2. Ensure the personal safety and that of the patient and bystanders. 3. Summon more advanced medical care as needed. 4. Provide needed care of the patient. 5. Assist a EMT and medical personnel. 6. Record all assessments and care given to the patient. Basic first aid for common injuries and conditions. Wound. It is an abnormal break in the skin or body surface. First, wash the wound or the break skin before applying a bandage. Nosebleed. Bleeding from the blood vessels of the nose. The aim is to control the loss of blood and make sure the airway stay open. Here's the some first aid tips for the nosebleed. First, help the person to sit straight or lean forward slightly. Second, firmly pinch the nose with index and thumb finger. Third, encourage them not to speak, swallow, or couch. Fourth, place a cloth on person's forehead and around the neck. Animal bites. Most common animal bites are from dog and cat, and the germs may be present in their mouth. The aim is to control the bleeding, minimize the risk of infection, and get medical attention. For the serious wounds, apply direct pressure on and raise the injured part to control the bleeding. Cover the wound with a clean pad bandage and bring the person to the hospital. Burns and scalds. The aim is to stop the burning, relieve the pain and swelling, and minimize the risk of injection. Do not remove the blisters, then bubbles form in the skin damaged by heat of friction. Because if you remove the skin that form like a bubble, maybe it cause of pain or infection. Food poisoning. The aim is to make persons safe and seek medical advice. Symptoms: stomach pains and diarrhea, fever and headache, nausea and vomiting. Here's the some tips to not having a food poisoning. Like example, noodles. Check the expiration date of the noodles. So after you check the expiration date of the noodles, do not eat the noodles if the expiration date is already passed, because maybe it cause of the food poisoning. Fainting. Reasons: reaction to a pain or fright, exhaustion or lack of food. The aim is to improve the blood flow to the brain, to reassure the person as he or she recovers, and to make the victims comfortable. Why learning first aid is important? It gives you tools to prevent the situation from becoming worse. In some situation, if a patient doesn't receive basic first aid care immediately, their situation will deteriorate often rapidly. By being able to provide basic care, you can stabilize a patient until emergency medical services arrive. You'll learn how to use basic household items as tools if a first aid kit is not available, meaning that you will be able to cope with many situations. Not all accident, injuries, or illnesses required to a trip to the hospital, but it doesn't mean they don't cause pain and suffering to the patient. A child crying because of a braced elbow or with a fever is in pain and is suffering. By knowing how to act, even just by applying simple techniques such as applying an ice pack correctly or utilizing appropriate bandaging, you'll help to relieve their discomfort. You will also provide emotional support by remaining calm and collected, which will make them feel more secure and reduce their anxiety level.